my topic is congenital abnormalities. So the basic introductions about this defects. An estimated 240,000 newborns are die worldwide within this 28 days of birth every year due to this defect. Birth defect causes a further 170,000 deaths of children between the age of 1 month and 5 years. Birth defect can contribute to the long-term disability, which takes a significant role on individuals, families, healthcare systems, and societies. So, what is mean by congenital abnormalities? So, it is an birth defect or congenital disorders or congenital malformations. So, it can be structural functional anomalies, for example metabolic disorders, so that occurs during the intrauterine life and can be identified prenatally at birth or sometimes may only be detected later in infancy after birth, such as hearing the defect. So it is in conditions which is present at the time of the birth, which varies in the standard presentations. So there is a statistics occurs under the basis of this defect. Brain anomalies 10 per thousand live births and heart anomalies 8 per thousand live births. Thousand live births and kidney anomalies are under 4 per thousand live births and limb anomalies 1 per thousand live births. These are the statistical analysis taken under the defect of congenital abnormalities. So there are various types occurs under this. Majorly limb congenital abnormalities called as the dysmelia. So at these conditions, the fingers are like extra fingers are added on their hand. For example, polydactyly or syndactyly, oligodactyly. Pocomelia is also in conditions under this congenital abnormalities. Second one, cardiac congenital abnormalities, patent ductus osteosus, ventricular septal defect, and arterial septal defect. And third one, neurological congenital abnormalities, it like spina occulta, meningocyle, myelomeningocyle. These are the neurological congenital abnormalities looks like. And gastrointestinal congenital abnormalities, atresia is in conditions which orifice as passage in their bodies, usually abnormal conditions or absent. So pyloric stenosis is a gastrointestinal congenital abnormalities, pyloric stenosis. So this is also a rare condition. So what is the major causes for this congenital abnormalities are the main factor is a genetic factor. So inheritance of the abnormal genes from the parent to the offspring. So chromosomal abnormalities, for example Down syndrome. So consanguinity, when parents are related by blood, also increases the prevalence of rare genetical congenital abnormalities and nearly doubles the risk of neonatal and childhood death, intellectual disability, and other abnormalities. Some ethical communities have a comparatively high prevalence of rare genetic mutations such as cystic fibrosis and hemophilia C. So marriage between the close blood relations are main causes for this kind of congenital abnormalities. Then environmental condition, intrauterine infections, Zika virus infections during pregnancy in case of the microcephaly and other congenital abnormalities in developing fetus and newborn. This will also affect the fetus. So drugs intake during pregnancy, steroids or anticonvulsants and cocaine, lithium, etc. And X-rays, maternal diseases, and improper nutrition, abnormal intrauterine environment, and maternal addictions. These are all the environmental factors which causes the congenital anomalies. And sporadic or unknown causes means 40 to 60% of congenital anomalies are unknown. These are referred as sporadic. So there are a lot of congenital anomalies are increases nowadays. So 40 to 60% are unknown. Only 40% diseases are only identified correctly. So socio-economic causes, maternal age and low socio-economic group. So what comes under maternal age means risk factor for abnormal intrauterine fetal development. Advanced maternal age increases the risk of chromosomal abnormalities, including the Down syndrome. Low socio-economic group, indirect determined higher risk. So these are the pregnant women's pure access to healthcare. And screening and testing, how can we identify this diseases? Matter and family history, miscarriages or consanguineous marriage, previous child with the deformity, physical examination, during examination structure abnormalities can ruled out. And amniocentesis at 14 to 16 with the help of amniocentesis, if there is any defect or occurs in a child, they will easily identify it, and maybe they can do some other factors. And chorionic belly sampling, maternal serum alpha fetum, USG biochemical assay. So management surgery is required on a basis of system affected and severity involved. How can we manage? Prevention, how can we prevent the congenital abnormalities means discourage the consanguineous marriage, avoid a late marriage and pregnancy um, above 30 years, and promotion of health of girl child and pre-pregnant health status of the females by prevention of malnutrition, anemia, folic acid deficiency, iodine deficiency, encourage the immunizations of all female child by MMR, protections of individuals and whole community against mutagens, and eliminations of active and passive smoking of tobacco by mothers. These are all the prevention factors. And avoidance of drug intake, so drug will mostly induces these kinds of disease causing factors. So prevention of intrauterine infections and promotion of sexual hygiene, efficient antenatal care, promotion of therapeutic abortions, and discouraging the reproductions, increasing the public awareness about the risk factors of the etiological factors, consider and preventing measures. Thank you.